still have 300,000 nurses short in the United States. We have less than 3 million MDs and doctors and caregivers in this country to serve 300 million people.
What drew you to healthcare?
I'm an engineer. I like to build things. And what better way to use all that experience to improve the human condition?
How do your AI co-pilots handle this complexity?
We automate that intake. An AI agent can actually go, read that information, extract the relevant.
How do you innovate quickly, and how do you change?
This is just a constraint system, right? So in healthcare, well, you can do certain things.
Do you find in healthcare that people are more likely to be cool with new technological advances, or are they more skeptical of it?
This is one thing that I think about it a lot, because the other side of AI.
Hey there, and welcome to Healthcare Journeys. I am your host, Kevin Rosenquist. Thanks for being here today.
This podcast is brought to you by S2M Health, a trusted partner for U.S. healthcare payers and providers. From accurate risk adjustment coding to full spectrum RCM services, S2M Health combines clinical expertise with precision operations to drive better outcomes across the healthcare ecosystem.
You know, AI is shaping or reshaping how healthcare organizations operate, but the real challenge isn't just building smarter algorithms. It's making them work for the people on the front lines, because otherwise, what's the point, right? My guest today is Ganesh Padmanabhan. He is the CEO and co-founder of Autonomize AI, a company transforming how health plans, providers, and life science organizations use their own data to drive better decisions and outcomes. Ganesh, it's good to see you. Thanks for being here.
Well, thanks for having me, Kevin. It's exciting to be here and talk about healthcare and AI.
Yeah, and a fellow podcast host as well.
That is right. That is right. Although I'm not as regular as you are, so stories in AI, and I have, I've a bunch of guest recommendations for you as well from there.
Awesome. Yeah, that'd be great. That'd be great. I'll definitely check your show out. I'm excited to chat with you. It's always fun talking to somebody who's got some experience in podcasting too. So I'm going to start just talking about you. You've worked across data and AI in different industries before co-founding Autonomize. What drew you to healthcare, and was there a moment that sort of set the mission in motion?
Yeah, look, no, thanks for having me. I mean, it's exciting to come and share our story here too. So, look, for me, it was like, I've spent all my life in the intersection of industry and data to drive outcomes, like reduce inefficiencies, use AI to actually transform things and stuff. And then circa 2020, the whole world got brought to its knees with...
Wait, what happened in 2020?
I know, right? I mean, just like people have very short memory, but
yeah, right.
It was just completely, it was, the whole world was blowing up, as you can imagine. I was building my last company at that time and had little kids under 5, and mid 2020, late 2020, I decided to leave and just focus on the family and stuff, and then got a lot of time to reflect. And one part of me was like, look, I've been in AI all my life, help people, help organizations, all this stuff with AI. But what am I going to tell my grandkids? That I help people shop more and search more with AI? Or I can do something more meaningful than that. Like, I'm a builder at heart. I'm an engineer. I like to build things. And what better way, what more mission-centric way than to use all that experience, all that power, all of this, amazing expertise in AI and data to improve the human condition, right? So Autonomize was born with the mindset of saying, look, how do we, in healthcare was like what 2020, that phase told us was the healthcare industry is broken, and it's broken in many different ways. But one of the most critical, impactful thing that came out of it is the ones who actually are in the front lines and delivering value to care. Like, imagine all of that. We still have 300,000 nurses short in the United States to actually help people too. We have less than 3 million MDs and doctors and caregivers in this country to serve 300 million people. And it is ridiculous amount of inefficiency that even the folks who are in there are actually dealing with all kind of red tape and paperwork and so forth. So it was a mission-centric approach to say, look, how do you change healthcare for the betterment of the frontline workers and to deliver outcomes to patients, and really promise fulfill the promise of, healthcare should be like accessible to all in a way and affordable to all. and making it happen for everybody. So that was the origin story. That's how I got into healthcare. And I did have a lot of background working with healthcare organizations across, health plans and enterprises and providers and life sciences and stuff. So I kind of knew how they work, but boy, I wasn't ready for what I found out.
Well, it's interesting too, because people like you who had more of a sense of of AI was coming before the general public.
Yeah.
Did you feel like at a certain point where you could feel it? Was there a certain point you could feel it change?
Well, it's funny you say, like, this notion of AI was coming, and a lot of folks, like, there's not a lot of folks, but there is a lot of folks who have been in AI. Like, my head of machine learning AI has been in AI for 30 years, and it's funny. And we were talking one day, and I was telling my kids, like, after ChatGPT, and my son is 11 years old, I was telling him, like, Dad, I'm telling him, like, I've been working in AI for the last 15 to 20 years, and it's awesome and stuff. And he looked at me and said, really? You must not have been that good at it, because it just came out. I'm like, what have you been doing for the last 15 years? I mean, that was literally that's the general public's reaction too, right? Like, well, AI just came out. What do you mean? ChatGPT just came out.
It came out of nowhere. That's what people
It came
like
out
to
of
say.
nowhere.
Oh yeah, that came out of nowhere. It's like, well, just no, it didn't.
It's been a long time coming in terms of things. So we knew that this was just a moment of time. Now, what ChatGPT, what it did was, people expected AI to be, like, always knew of AI to be math, right? It's just like, it's going to do better analytics and look at a lot of swaths of data and give me something. They didn't expect two things. One was how good AI was. People were not, expecting that it is actually that good, until it came into a consumer's hand and to an everyday thing like writing a letter, writing an essay or a summary, which just seems so mundane, but it's very human, right, to do. Until it actually unlocked that and said, I can't believe an AI wrote that. So this is AI, right? Now, this is one use case of AI that came out of it. So one was that expectation gap with what people expected AI to be and what it actually was. That was collapsed. So that was one big thing that happened with ChatGPT. The other thing that happened was people expected AI to be analytical and mathematical, and creativity was always a human domain. And all of a sudden, there was this wow surprise factor that AI can now be creative. It can generate art, it can do full form videos, it can create content, podcast content, all of that stuff. And people are like, this is something, ridiculously awesome, right? So that whole expectation gap was the one, because historically, if you look at the performance of machine learning models to look at a picture and identify the object in a picture, to a grainy picture and identifying what's in it, to look at listen to an audio and understanding intonations and tone and sentiment and all of that stuff. Independently and atomically, AI far outperforms human behavior in each of that stuff, each with the atomic capabilities. And that happened before ChatGPT. What ChatGPT did was actually you package it it was a product packaging exercise that gave it to the masses, and it completely transformed and it collapsed the expectation, spectrum for the average person. So, I mean, we knew it was coming. We didn't know it was going to be this big, and it was like, it's going to grow so fast in adoption.
Yeah.
Now, that's the one side of it. The other side of this is, of course, right, like, is it as good as people really think it is? It's a very questionable thing. It's getting better every day and stuff. Is it applicable and for any task and everything? Can it really take jobs away and do full people jobs and stuff? All of that is still work in progress and questionable claims. There's a lot of claims, but there's a lot of reality to it.
Well, like any technology, you figure out what we're doing with it. It's the math, the methods. Like, I mean, even just like before we hit record, I was telling you how I redid my studio and I struggled with the lighting. Well, I was taking screenshots and uploading it to ChatGPT and saying, like, how can I get this to be a little bit better? And it was doing a great job. It was like, because I don't know anybody who's good at lighting, so like I was like, I don't know who to ask, and it was amazing.
It is, so it's so unbelievable, right? If you really think about what AI and this generation of AI really does, is like everybody now can get an assistant, right? An intern who can do things for you. And
Sure.
you're not, so what internet unlocked for everybody was access to information that's in there, right? What this generation of AI really unlocked for everybody was intelligence at your disposal. right? You can have a human-like intelligence, not exactly like a PhD student most of the time, but you want someone to run down two different documents and summarize exactly what's in there and help you make a decision better. Now AI can do it, and it's accessible for $20 a month. That's ridiculous, right? So now imagine the explosion, the Cambrian explosion of human productivity and creativity that can happen because of that intelligence being in your fingertips. That is very, very powerful at this time.
Mhm. I know a lot of people in the creative space. I'm a former musician myself. My brother's a musician. A friend who's a fine artist. They are very much not thrilled with AI. They don't like, and which is, I think, something that we kind of understand to some degree from the creative side. They don't like seeing AI generated content. But one thing I always tell them is, if you could see what's happening in healthcare, if you could see what's happening in other areas and what it could do, what it could mean for that, there's always going to be good and there's always going to be bad with any technology, right? So
exactly,
what people are like you are doing in healthcare is makes the other stuff kind of worth it in a lot of ways, in my opinion. I don't know, where do you land on that part?
so there's two things, right? One is like, to all the artists and folks who are like innately thinking like art should be human and stuff, right? The what I don't think they're all seeing right now is what this will do is it democratizes forms of art. Well, if you're unique and you have a unique expression, and there's copyright issues and stuff, that aside, what the democratization does is actually make your art more unique to yourself. And so you realize that art is not just about the picture that gets drawn. It's the story behind it. It's who you are. It's all of that stuff. So in fact, what this should do is the good artists, the folks who really have a powerful story to tell, will become even more popular, even have more opportunities. Because like, even for us, like, you can generate art of any kind right now. But we do a lot of, artwork at home, and we now go seek out unique artists who doesn't look like an AI generated art. Right. So it's got the opposite side of things where, like, it's like how luxury goods started becoming more and more luxury. LVMH made a lot more money when it was easy to make a $2 handbag, right? And then, so they had a story, they had the brand, there's all of that stuff. It is going to make everybody more fuller in terms of, like, it's not just a task, it is the holistic thing. And so that's one point. And then on the healthcare side, of course, I think, look, today, just in general, like, not just healthcare, humans have far exceeded our capacity to take in all the information we have around us to make decisions. There's just no way we can do it. We are being bombarded with so many things. Our attention span is not what it used to be, all of that stuff. The only way you can actually have a higher quality of living in general is to get assistance to process all this information, help you make decisions, and so forth. And so AI is here to stay. It's going to be pervasive. It becomes like compute and cloud and things like that, where, like, you just have access to intelligence at a fingertip, and it doesn't cost you $20 an hour, right? So that's the idea. Now, in places like healthcare, where you're innately dealing with folks, and it's the interesting thing about healthcare, healthcare has got a lot of problems, but one of the biggest problems is access. There is 8 billion people in the world, not enough doctors, not enough nurses, not enough caregivers to take care of everybody. So you can democratize access to care using tools, using capabilities, the ability to find information on the one hand. On the other hand, those folks who are there are burdened with, like, an average doctor, there's a lot of studies done, a physician in the United States spend more than 60% of their time doing the administrative processing, writing notes, updating information, processing referrals, answering questions from insurance companies, rather than taking care of patients, right? So 60% of their time, more than half the time. And that's not acceptable. So if you can focus AI on problems like that, where they can just walk in, have a conversation with their patient, because guess what? The last time you went to a PCP, they're looking at a screen, then talking to you in person, because they have to. There's regulation involved. They have to take notes. They have to look for information, hunt for information. Imagine all that goes away, just like Iron Man and Jarvis suits, right? So you have Jarvis, the assistant for the doctor, coming in behind the ears and telling them, hey, this patient has got a history of migraines. It's the last time he came in. Here are the medication they're on. Here's what they have actually done. And this whole thing is just prep for him. The case is prep for the doctor. They have the content. They can focus on delivering care, talk to the patient. Because what people don't realize is healthcare is not just this country. We treat healthcare as sick care. We're just taking care of sick people. But there's a care aspect of healthcare. And that's what makes healthcare powerful. it's the doctor. There's a lot of studies being done, right? You meet the doctor when they have the way they converse with you, the empathy, all of those human elements make you feel better on an ailment than just an antibiotics working on the bacteria.
Right.
So
Yeah.
there's a lot of that thing, and it really puts in places like healthcare, AI can really help folks work at the top of their license. It can help increase access to care, and it can lower the cost of care because it wouldn't take that much to actually, employ really expensive people to go deliver care at the edges.
Mhm. Yeah, it's an interesting point too, because yeah, I mean the personal relationship, that part of the doctor patient relationship is very important. Like you said, it's not just the antibiotics; it's getting the information, it's having the empathy, it's having the understanding, and if doctors are being pulled in so many different directions all the time, they're not going to be able to give that specialized attention to you, that empathetic attention. So you talk about the clinical notes and all that stuff. You've got PDFs and faxes and tons of unstructured data. So how do your AI co-pilots handle this complexity, and how does it affect day-to-day operations?
No, it's a great question. So I'll take a simple example. So first up, like what these AI co-pilots are just AI assistants. And
Mhm.
when you take a complex process in a workflow, and I'll take an example of prior authorization. Everybody hates it. Everybody knows what it is. But it's basically insurance companies requiring the providers, the doctors, to get pre-approval for an expensive procedure or a drug, right? Very needed from one perspective, which is like to make sure that, like, when you have most of the healthcare system working on fee for service, you want to make sure there are some controls and things like the right patient is getting the right care at the right time and so forth. But what it's evolved into is a very complicated process that causes delays for care for patients. It makes it really burdensome for health plans, employ hundreds and sometimes thousands of nurses and doctors. At the same time, our hospital systems are trying to fill those open vacancies because they're all working with insurance companies. So it's a messy system. So day to day, you think about a health plan or a health insurance company, they get about 100,000 requests. A national health plan gets about 100,000 prior authorization requests for a procedure like radiology. I want an MRI scan for a patient that is in having headaches and migraines, and we want to test their check out what's happening in their brain. Well, that leads to, it comes in what PDFs, faxes, HL7, all kinds of information. There's often someone that's employed to go type up that information in an internal system. And they're not just doing data entry, but they have to validate that the patient exists within the database. They have to make sure the requesting physician is part of their network. If not, they reject it. There's all of this work that happens. Someone takes about 10 to 15 minutes per case. We're talking 100,000 cases a day at a minimum. They spend 10, 15 minutes typing up that information, validating information, checking eligibility and stuff. And then it goes to a nurse who's paid $80 to $100 an hour. And the nurse sits and reviews all the medical charts that is attached as PDFs with that particular request, because they have to show 6 months of history, the exacerbation of their condition, and they're reviewing for medical necessity. Is it a required procedure? Is this going to help this patient, or just going to put them through more, troublesome, go round and round, and they're not going to get to resolution? What does the clinical protocol say? What does the medical necessity protocol say? All of that stuff. And they go write that summary. Now, in case if it's a denial and it's not an approval, or they need more information, the government, the CMS requires them to hand it to an MD who is licensed, also employed by a health plan, to review it. They call it, medical review or peer review or MD review. They have to sign off on it, and then it's given back to the prescribing physician, say, hey, you didn't attach information about this particular history or this particular condition or these lab tests. Once you're done, we'll approve it, or this doesn't need to be done this way, you have to do it something else, and things like that, right? That whole process takes about 3 weeks for the patient to hear back, 2 to 3 weeks. It takes about 60 to 90 minutes per case. That is all humans that are actually doing this thing. How AI co-pilots, how we've been helping health insurance companies or health plans is like, we automate that intake. There is nobody needs to type up information, validate, and run across multiple databases to ensure that the patient exists, the provider exists and stuff. All of these are different systems, and it's people have to do it because these systems are old and all of that stuff. An AI agent can actually go and read that information, extract the relevant information, check against databases, and then come in and build a summary of that case for the nurse. And a summarization agent will go in and say, I'll go fetch the right clinical guidelines that it relates to this particular condition for this ICD code and this CPD code, summarize that information, package it, give them a checklist of saying, here's what the requirements guidelines say, here's where they meet or don't meet, and here's the rationale, here's what we saw in the charts. The whole thing is set up for them in 4 minutes. They can look at it and the MD can sign off saying, yep, this is right or not. Now, even better, if it's an approval, you don't need to. You see that AI is usually your strictest nurse that's going to look through these things because it goes by by the letter of what is written in the documents. You can just auto approve it. You can just increase the velocity of it. The patient's not waiting for 2 or 3 weeks. They get instant, reaction of like what they request, or whether it's getting approved or they need to furnish more information. The provider, the prescribing provider, is not facing abrasion. They're like, not, oh, this insurance guys. We have tons of these selective YouTube videos. If you look at it, doctors calling in and complaining about a health insurance company denying their claim. I have patients getting there and stuff like that. And it's the system, right? It's not that the insurance company wants to deny blindly. It is not that the doctors don't want to do it. The doctors also have to package information that correctly identifies the reasons they have to be approved. They don't have the time to do that.
Right.
Then on the other side, it's just the volume of cases coming in. They're just going to look at what is the fastest way to, because that's going to help the patient to get a decision sooner than later, right? So there's all of these things, and the system needs AI assistance to automate parts of that particular thing. So that prior auth example, we actually compress the time for an authorization review to happen that takes about 90 minutes to 4 minutes or less. Imagine the impact on that on millions of authorizations a month.
Yeah.
Right? It's just ridiculous. And the patient wins at the end of it because they get to hear back very quickly. If there's any problem, if you have access to the EMR data, you can go and fetch the right information that is needed to be attached to this to the case to get it approved. All of that things happens automatically. And that's where AI is like works best. Versus like, can I have an AI nurse that does all these things on by itself? Well, you're gonna fall flat on your face because the nurse does more than reviewing information.
Right. Yeah.
There's that historic context and all of that stuff. So that's where practically you can apply, and you can apply this to clinical quality reporting, risk adjustment, claims processing, visiting physician notes, referral management, denials and appeals and grievances. All of these processes require swaths of data to be analyzed. It has to be contextualized to the particular case in hand or a particular context. That's where AI is today, that can be powerfully put to use and deliver value for everybody.
Yeah, and that's awesome. I mean, that because you said that it's better for the patient, and you got to assume it's better for the other patients too, because now these nurses and these doctors, these professionals can take their time and put it elsewhere. Exactly. Instead of doing all this stuff. And another thing that I thought of as you were talking too, I mean, it's not earth-shattering or anything, but I mean, human error is a real thing, right? And if you're doing these things you're talking about, if you're a nurse or someone, it's the end of the day, you're exhausted. You've been seeing tons of patients. That's and then all of a sudden you're doing these things, and you just miss something. You miss it's understandable. You know what I mean? That there's a human error aspect there.
I had I lost a friend to stage 4 breast cancer a few years ago, and one of the original stories of like when I got really enamored on this and stuff too. And she had a very rare gene mutation, which the only way you can solve that kind of cancer was immunotherapy, or like you're turning your body's immune system against that. Now, when she first had the occurrence, there was this, Merck has a very famous drug called Keytruda. It's a very popular drug, really high success rate immunotherapy. They were running their clinical trials, right? And when she first had the occurrence, now clinical trials are like, I'm going on a tangent here, but like it's an interesting story. It's an important story. But clinical trials are like, it's needle in the haystack trying to find patients who match the trial criteria requirements to be put into a trial. So they get the experimental treatment, and if they get successful, that goes, and you can attach that as evidence for FDA approval, the whole night. It's a really long process. It's a really complex process. And her charts showed that she had that mutation that was needed for Keytruda to be successful. Now, she had one chance to get into that trial and go through that process to get, let her body take care of that. She tried it later on, and Keytruda didn't work for her at that time, but she had that window. But the fact that she had that particular BRCA mutation on her gene expression was in page 349 of a 5,000-page medical history chart. Easy for anybody to miss. And
Absolutely.
nurses are actually reviewing 10,000 charts to identify 200 patients who are going to fit into a trial, right? So this is personal for me. Like when I think about this, right? And it's a errors and omissions are a real thing, especially when they're so overburdened with so much volume of data. There's just no way, especially in healthcare, that caregivers and doctors can deliver care without AI. I mean, it's almost a necessity. It should be a mandate to be that fact. Like you have to, and then you have to go upstream. Right? There's a lot of misinformation about AI, what AI can and cannot do, and all of that stuff. But I think you have to make this. You have to figure out, how do we have these folks who get through medical college and get through education are comfortable getting out of it, co-working with AI, because the future enterprise is going to be a hybrid enterprise. The future society is going to be a hybrid society, right?
Yeah.
You're going to have AI and AI agents and robots and humans all coexisting, co-inhabiting hospital rooms, operating rooms, health insurance companies and all of that stuff. So you have to figure out, how do we help enable a hybrid enterprise for healthcare institutions to deliver the best care possible for patients all over.
I think what's cool about these agents too that we're talking about is, one of the things that I talk to other guests about is trying to build on like these legacy systems that a lot of doctors' offices and hospitals have, especially if you're doing some like rural doctor's office where they just do it old fashioned and stuff. But for what Autonomize is, since it's an agent, it's not really all that important for the actual stack to be super current. Am I right on that?
Yeah, no. So exactly right. So healthcare is old, and it's like, it's complicated. It's a lot of legacy. And one of the things we learned early on is, if I go in and say, no chief information officer or chief medical officer wakes up every day in healthcare saying, I have to change my medical management system. They don't do that.
Yeah.
That's not the way they work.
It's more like, oh God, I have to change my
It's like, they're like, I want to get some efficiency back. I want to get, reduce time and stuff like that. So what we did was initially focus heavily on, how do you layer on top of the existing systems of record? And it's painful, to say the least, right? Because some of them don't have APIs. They're not a modern stack. There's all of these stuff. So what we do is layer, we call an agentic layer, on top of their existing systems of record to extract information and context from it, and then deliver the workflow that they want outside of that original system of record, right? So that way, everybody wins. I mean, of course, it's a lot more painful for us to do that than just giving them up. Forget your legacy software, use your new software here. But that's not, healthcare is messy. It's if there's gaps of knowledge, gaps in information, there's legacy systems, and don't get into healthcare if you're not ready to deal with the mess, right? And that's where the fulfillment comes in as well, right? You're solving these hard problems. And sometimes the hardest problem is not your AI delivering the right summary. It's integrating into that legacy system that actually, and it has a time window that you can actually ping it and get a response back. And it's those kind of problems, but these are all engineerable problems, and we solve it that way.
One thing that I always find interesting about any new technology in a space like this is how tightly the space is regulated. You've got HIPAA, you've got FDA guidelines, other regulatory hurdles. How do you innovate quickly, and how do you change, make changes and iterate on things in such a tightly regulated industry?
Look, I mean, I fundamentally believe that constraint drives innovation, just in general, right? So this is just a constraint system, right? So in healthcare, well, you can do certain things. You can just use that data to do other things, and you can, there is a way you have to handle the data. There's all of that stuff. So there's HIPAA, SOC 2, Type 2, those kind of technology requirements on the one hand, which I think is good, because it's good for, you don't want to do misuse of that data and all of that kind of stuff. So those are the constraints you have to deal with. On the other hand, there's things that you have to be, I don't always agree with everything. Like, for example, you compare AI's performance rates to human rates. AI performance is usually much better than humans in almost every case, in every task you perform. Yet you would trust a human judgment over something than an AI making a judgment. And there's for a reason, right? There's the accountability, who's accountable for it, are they trained to do it, all of that stuff. So we respect and understand the constraints that come with it. But I think it's going to be a process where, it's going to be a process. So it's going to have to be, you're going to go work with these individuals, because there's a lot of bi-directional thing. One of the things that we learned very quickly is, in healthcare, to do anything, you have to think about it as a, as a continuum of human machine spectrum, right? Or in other ways, you have to bring the human in the loop. You have to, you have to get right the handoff between what AI can do and what humans can do. And you have to make sure that, collectively the system works a lot better, but then it's not going to just be an AI doing something. Some tasks make sense. It's an administrative task. You don't want the human to even bother their time to do it. But in places, because there's a lot of gaps in knowledge, right? When you go to like care managers and you think about it, like, how do I deal with a CPAP machine request for this patient with this pattern? Oh, let's ask Sally. She's been doing this for 30 years. It's not written down on a job aid or anywhere. It's just Sally, right?
It's in Sally's brain.
It's
Yeah.
in Sally's brain. And so you have to account for that. You have to, and there's a lot of that contextual deep knowledge that is embedded in the workforce. And so you have to figure out, you have to master the handoff between AI and humans to go make sure that you deliver a collective experience. So that's something we did like early on to say, we understood very quickly that like, there's a lot of agent washing going on in the industry, right? So an AI agent is going to replace the doctor or the nurse, and it'll be a nurse agent that'll do your denials. It's a lot more complicated than that, right?
Yeah.
So what we have done is being able to do that in a fashion wherein, you can master the handout between human. Where do you bring the human? Where do you actually have the agentic AI do the stuff? And then collectively make the system drive better improvements, right?
Yeah, I mean, I think it's interesting. Like even you look at technology and how resistant people can be to it in certain areas. I mean, I think it's funny that we've had the ability in something silly like baseball to have automatic balls and strikes, so that there's no worry about whether the umpire gets it right or gets it wrong. But we don't. But people resist it still. Do you, because I think it's a purist thing probably or something like that, but it's like, but we could get this right 100% of the time. They're like, no, we don't want to do that. Do you find in healthcare that people are more open to technology to help the actual, I'm talking about the average person. Are they more likely to be cool with new technological advances, or are they more skeptical of it, or is it somewhere in between?
Yeah, I think, look, it's more nuanced than that, right? So one is, so in general, people will use technology if it helps them, right? So to me, it's almost every example, even the, we didn't have cell phones. Now we can't live without cell phones, right?
Yeah.
We can have smartphones, right? So it'll technology, if it is solving a real problem or giving them an experience that they didn't even know that happens. So healthcare, by definition, is a little bit more risk averse. I mean, rightly so. So there is a skepticism that happens. Now, this is one thing that, again, I think about it a lot, because the other side of AI is user experience, right? One is like what the AI can do. But the second thing is, how do you drive adoption? And the adoption, what you have to give them the evidence that's helping them. So what we see in healthcare is, yes, there is a lot of resistance to change. There's like, Sally doesn't want to actually trust, an AI agent telling them that they should think about the CPAP machine this way, because Sally has done it for 30 years. Now, Sally's also very frustrated at the fact that she has to mine through 69 pages of information to validate what she has in her brain to make that decision. You can solve that problem for her, and Sally becomes a fan, right? So things like that, we have to really think through, what's the user experience you're trying to deliver?
Yeah.
And in cases like in healthcare, you have to be, simple things. We did some really interesting things. Like we remember like 2 years ago, when we were 3 years ago, we're starting off, we were helping some, claimed adjudicators. We gave them a chat bot kind of an interface to say, ask any questions about the CMS policies that you want. And we saw that nobody even used it. For like 6 months, we're trying to tell them this, like, and then you talk to them, they're like, yeah, but it's work for me to go and do something else to get the answer. Well, like our, product guys came about, like, we have a better idea. Well, what are they doing? They're actually clicking from here. They look, where they're spending time on in that particular system. So before they go to the next stage, they know what they've been working on. Why don't you surface the information they're going to look for or going to start to think about before they even ask for it, right? As an example. Well, that changed. Adoption went through the roof, right? As an example. So it's more nuanced in terms of, it's different in every workflow. It's different in every particular thing. But I think, anybody resisting it, it's a futile resistance,
Absolutely,
right? To be honest, right?
Yeah.
But it's like, I think folks, but it's also the responsibility of a technology player like us to say, look, you have to really understand the user. You have to understand the workflow, and you have to make it so nuanced and easy for them to get engaged with a form of intelligence that's going to be helpful for them to go make. And as long as you make that connection, you prove it to them, boom, it just catches fire after that.
Yeah, and it has to kind of it has to catch up to how people operate, right? Like people, guys like me and you, we love technology, fascinates us, so it's cool. But like when ChatGPT first came out, and you had like you had to do certain prompts, and if you didn't prompt it the right way, you couldn't get the answer that you want. And there were things called prompt engineers and like all this stuff. And now it's just like you can be like, hey, what's up? Hey, I got a question for you. You know what I mean? You can talk to it like it's a buddy sitting across from you. Whereas when it first started, it wasn't like that. So yeah, I understand what you're saying. When you can get it to a point where it's user friendly, the UI, the UX, everything works, and it makes sense for people, then all of a sudden people are like, now I get it.
The process, what you're also doing, and what we do, for example, is like you're capturing the nuance that only Sally knows today to get it democratized for everybody else to access. Like what ChatGPT did was like those prompt engineers prompting made them realize how to actually interpret certain things in the right way, where they get happy with the results with that, and then map everybody else's needs to that particular core source of knowledge, right? We can do that. And that's how you transform operations in a complex industry like healthcare, like one workflow at a time, engaging with the user, engaging and capturing their nuance into the system, and then democratizing it for everybody else.
Real quick, as we finish up here, are there any areas of healthcare where you think are ripe for AI disruption, or just helping? Like where could it really make an impact that maybe we're not seeing just yet?
I think, look, the promise of personalized medicine, we've been talking about personalized medicine for everything, right? So if you look at like evidence-based medicine was about like, how do I find usually a group of Caucasian folks who actually have gone through a clinical trials, that becomes evidence, and you're trying to apply that to everybody else as an example, right? With personalized medicine, now you have the tools. You don't have to go through that same clinical trial process. You don't have to go through the same analysis process of researchers, scientists, doctors spending all the time. If we can figure out a playbook to say, look, what do I know about this person physiologically, physically, genetically, all of that kind of information? Because personalized medicine today is just code word for genomics, right? And it's more than that. It's like a lot of the facts is your nurture matters more than just the nature, for example. But you now have the means to analyze all that multivariate, multi-structured data, and being able to just then package that to deliver. Like imagine having today, and there's companies looking at solving these problems, right? We all take multivitamins and supplements and stuff. What's that supplement stack just for you to optimize for your goals, right? And then you can tie that back into, because manufacturing has now become automated with robotic manufacturing and all of that stuff. Care delivery will become more. The doctors have the tools to go do it. If you link it all together, you can truly solve problems. Like, we need to go away with today. When we talk about healthcare, we talk about costs and access and abrasion and stuff like that. This conversation needs to shift to longevity, quality of life, and how do you live your best life and stuff. And for that to happen, all the messy stuff that we're doing that nobody wants to do but still have to do can be done by AI. So I think personalized medicine will be that big leap that I think it can. We're close to making it enable. We're seeing this in the way that you're using, you're doing bioengineering or generative biology, wherein you're trying to figure out how does a protein react to a particular gene expression, what are their costs and stuff. A lot of this is more correlation than causation today. But as we evolve it and we start to analyze data beyond just a single domain, but a multivariate domain, now you can truly solve that problem of personalized medicine at scale, right? So that's one thing I'm super excited about. But today, just like the problems in front of us, I tell you, admin burden removal. If you just solve that, it's going to unlock more than $1 trillion in the market today in the US. And we're fighting over all the Dodge and all of that stuff too, right? You have $1.2 trillion right there for the taking if you reduce the admin burden across the industry. So I think that's the most, right in front of us, opportunity for us to really make a difference.
Yeah, I would say so. All right. Well, I love it. All right. Well, the company is Autonomize AI. Ganesh, thanks so much for being here. Really enjoyed the conversation.
No, thank you. Thank you, Kevin. Thanks for having me, and thanks for the thoughtful questions.